ahead. If a woman has COVID-19, should she still be breastfeeding her baby? It's a growing concern among new moms. So we are talking about this issue, getting some expert advice from Dr. Sharon Thompson when we come back in a few minutes. Stay with us. Well, we have all long known the benefits of breastfeeding for newborns and for mothers. But there has been some growing concern about breastfeeding because of COVID-19. And sometimes the question arises, should mothers stop breastfeeding altogether because of those worries? Well, August is actually Breastfeeding Awareness Month. So we are talking about this very important issue with Dr. Sharon Thompson this morning. Good morning, Dr. Thompson.
Good morning. Yeah, this is a month where we want to emphasize the benefits of breastfeeding to moms. And this August, even though this year has thrown us so many curveballs, is no different. Breastfeeding is the primary way to feed human babies, and it has lots of benefits. The question for this year was, does coronavirus make a difference? And early on, there were some mixed messages about that. Some hospitals separated moms and babies and discouraged breastfeeding. But now we've looked at the data worldwide, and a resounding mom continue breastfeeding is the message.
And that's why the CDC actually, I know it was, I believe in early June, came out with new guidelines for breastfeeding in mothers. What do moms need to know? We know how important it is for breastfeeding, especially in the first 6 months of life for a newborn.
Yes. So we want moms to know that breastfeeding is still the best food for your baby, but you do want to take precautions against transmitting COVID virus to your baby if you have it or are suspected to have it. So you want to take the same precautions that we recommend to everyone. Wash hands carefully before feeding or holding baby. Wear a face mask if you know that you have coronavirus or at high risk for having coronavirus, so that you can reduce the chance of transmitting it to your baby.
There's been so many worries for pregnant women during this whole time period, from when we first started seeing cases. And I think it's interesting you mentioned, they were even some hospitals were separating babies and mothers. All that no longer the case, correct? In fact, they want to continue, especially the contact between mother and baby.
Yeah, we definitely have realize that there's no need to separate moms and babies, and that we've known for a long time that those early hours after birth are so important for babies and for moms. We want moms to be able to do skin-to-skin contact with their babies and to encourage breastfeeding that really provides babies the only immunity that they have in those early days is what they get from mom's breast milk. So we don't want to deprive babies of that very important first immune system.
We've seen cases where a baby has been born with COVID-19. Have we seen any cases, or what can you tell us about breast milk and the transfer of COVID-19 or coronavirus in breast milk?
There's not a lot of data to go from. The WHO recently reviewed about 46 cases of early infants and coronavirus. Moms all had coronavirus, and only in one mom were viral particles, no live virus, but viral DNA found in the breast milk. And it's not clear. I'm sorry, it was 3 cases coronavirus was found in the breast milk and 1 in the baby. And it's not clear if that baby got the coronavirus from that breast milk or from the usual means of getting it. So there's really not a lot of data to go on, but we do know that the benefits of breastfeeding are so great that we don't want to deprive newborns, vulnerable newborns, of all those benefits for a very small risk, potentially, of coronavirus.
And we know breastfeeding is not always easy for women. It doesn't always happen naturally. Since it is Breastfeeding Awareness Month, we do want moms to know that there's lots of help out there with lactation specialists and things like that.
Oh, definitely. Breastfeeding is a learned behavior for moms and for babies. And so learning takes time. So I want moms to understand, just stick with it. Ask for help from your nurse in the hospital. If you go home and you're having trouble, reach out to your obstetrician, or if you know a lactation consultant. But if you don't, your provider can help connect you with one. It is very common for moms to need some help, moms and babies, to need some help in those early days. So stick with it.
Great advice. Dr. Sharon Thompson, we always appreciate talking with you. Thank you so much. Be safe and be healthy.
You too.